4 months ago, 6-year-old Ellie Porter was diagnosed with a rare form of cancer. While she's been fighting for her life, her father has been fighting against Obamacare because the family's plan was canceled because it didn't comply with the Affordable Care Act's high standards. And now the father and the mother are struggling to find a plan to cover their daughter, but everything they've looked at so far, the premiums have at least doubled. Joining us right now is Ellie's father, Dr. Paul Porter. He joins us today from Salt Lake City. Paul, good morning to you.
Good morning, Steve.
Terrible news. We feel terrible about your daughter. When this hit, and you were covered by the policy that has since been canceled, you probably had some worries about whether or not it would cover everything, didn't you?
Oh, no doubt. Yeah, I mean, when something like this happens to your family, you don't know. There's so many unanswered questions that you kind of wade through. But when we were confronted with this diagnosis, we were absolutely scared about what our insurance would cover things. But we were actually pleasantly surprised.
So it's been able to cover her cancer treatment so far, the removal of a kidney. You were happy with your insurance?
Yeah, we were very happy with our insurance, actually.
And then you got the letter from the insurance company saying you've been canceled because it didn't rise to the high standard of the Affordable Care Act. When you saw that letter, considering what your family has gone through, what did you want to say to the President of the United States?
Well, definitely frustrating. I mean, our story is different in that we are going through a very hard time, but there's millions of families around the country that are going through the same thing. So, I mean, it's just adding to something for us that we didn't need at this current time. So, I would say frustrated and a little bit scared of just the uncertainty again of we don't know what's going to happen, you know, where we're going to be.
So you got the letter, you've been canceled, you got to come up with something new, you've looked at some policies. We're gonna I hope you don't mind, we're gonna put up your financial data. The current policy costs you $364 a month. But to get something that rises to the Obamacare standard, it's gonna cost more than double. And one of the worries you've got, along with your wife, is the new policy, wherever it is, you don't know if little Ellie's doctors are going to be in that plan, right?
That's exactly right. You know, that's something that we have to consider. We've been extremely happy with the care that she's received where she's at a great children's hospital. And thankfully our plan, they're an in-network provider for our plan. So we definitely have to look at that as we move forward. And any plan that we may consider would definitely have to be a top priority for us.
So you've got such uncertainty because the government is essentially telling you, you know, what kind of health care plan you can have. Your daughter has been fighting for her life. How is Ellie right now?
Ellie's doing well. Right now she's actually starts today with another round of chemotherapy. And she actually gets scans today, so we get to see if there's any new development in the disease, if there's any new tumors that's popped up. So we've got a big finger crossing going on today, and hopefully around noon today we'll have good news.
Well, we're all praying for you. Paul?
Thank you.
Keep us posted on what your family decides to do. It's a rough story, especially around Christmas time, where you simply don't know what the future holds for your family.
Yeah, it is a little uncertain, but we're moving forward with faith and a lot of prayers, and we're going to be positive about this.
All right, we are as well. Good luck to you, and our best to Ellie. Dr. Paul
Thank
Porter.
you.